The next question comes from Anna Rao and goes to Congressman Daines.
Representative Daines, despite the House's best efforts, Congress has been unable to repeal Obamacare. Even if Republicans gain control of the Senate in this election, Obama would certainly veto any repeal effort, and an override is highly unlikely. Given these political realities and the fact that millions of Americans and 36,000 Montanans have already signed up for the Affordable Care Act, what would you do about it? Would you continue to try and repeal it, or would you try to fix it?
Washington, D.C. Center solutions are usually not the right solution for Montana. We need to have a Montana-centered solution. When this legislation passed the House and the Senate and was signed into law by President Obama, you saw what happened across the country as the American people saw their premiums go up, they've seen their deductibles go up, and it's not solving the original problem, which is trying to provide better accessibility and affordability to health care. So what we need to do is we need to come up with a Montana-centered solution. We still have the problem, but we need to have a solution to that problem, and it needs to be a Montana-centered solution. Again, we don't need to have a one-size-fits-all federal takeover of the healthcare system in this country. States like Indiana have already moved forward here with some of their own ideas as they're looking at what they need to do to address the issues in Indiana. Similarly, in Montana, we have different challenges than in states like New York, Florida, California. So there's a couple parts of that we should look at in terms of allowing young people to stay on their policies till they're 26 years old, dealing with pre-existing conditions. But we need to start focusing on allowing the patient to get back into the center of that equation, because the federal government has taken away freedom and liberty in health care by mandating what that choice needs to be.
Mr. Roots, your answer?
These two government supremacist parties have destroyed health care. They have, listen, every one of these huge enactments, Medicare, Medicaid, Obamacare, they all have the same result. They increase demand without increasing supply, causing prices to rise. Healthcare prices have been rising faster than the rate of inflation every single year for 30 years. Obamacare just adds a little bit more to that. So as your U.S. Senator, I will work to repeal every single one of those, Medicare, Medicaid, even the requirements that, the prescription requirement is unnecessary. We shouldn't need to go to a doctor first and then go to the pharmacy. The pharmacist himself is highly educated. We need to eliminate and deregulate all of these things. We need to legalize drugs, legalize medications, make everything available over the counter. We would bring costs down. If we unleash the power of capitalism on health care, the poorest man in the world could stumble out from under his bridge, bleeding from 1,000 open sores. He could stumble into a roadside medical tent and be restored to full health for just $49.95. If we unleash the power of capitalism on health care, you could get a kidney transplant during your lunch break at Walmart and be back to work after lunch, and it would cost you about $69.95.
Senator Walsh, your answer?
Over the past 10 or 15 years, we have seen healthcare costs in this country continue to rise. And in some cases, it's unattainable for a lot of Montana families to obtain quality health care. So we need to make sure that we are moving towards a system that all of our citizens can receive quality, affordable health care. With regard to Obamacare, the jury is still out from my perspective. The president promised that we would see health care costs come down. He promised that if you liked your insurance company, you could keep it. He promised that if you liked your doctor, you would keep him. I'm hearing from Montanans that that's not the case. And so until I see the costs of health care come down in Montana, the jury is still out from my perspective. But the only plan that Congressman Daines has come up with so far with regard to reforming health care is to privatize Medicare. What is privatizing Medicare going to do for the citizens of Montana? It's going to shift costs onto the backs of our seniors and raise costs on them several $1,000s. That's not the route that I want to take. I think we need to come together and come up with ideas in order to bring quality, affordable health, provide quality, affordable health care down for our citizens. My wife is a diabetic. She's been a diabetic for 43 years. We were always concerned that we would lose, if I were to lose my job, she would not be able to maintain her health care. Now, she doesn't have to worry about that because pre-existing conditions are covered. Just like thousands of other Montanans. I have a son who's 24 years old who can stay on my health insurance until he's 26 years old. So those are a couple of good things. We need to continue to come up with ideas to move forward with providing quality, affordable health care for our citizens.
Congressman Daines, your response?
John says the jury is still out. Well, I've got news. The Montana jury has rendered a verdict, and they don't like Obamacare. And this becomes a choice that we have to make. Are we going to stand with Barack Obama, or are we going to stand with the people of Montana? We need a Montana built and centered solution to address our health care costs, not one that comes from Senator Barack Obama, Nancy Pelosi, and Harry Reid.
Mr. Roots, your response?
I'd like to point to there are a couple areas of medical care in this country that are not paid for by any insurance plan and are not paid for by any government program of any kind. One of them is LASIK surgery. Another one is breast implant surgery, a lot of facelifts. These are things that you have to pay for out of your own pocket. And guess what? Prices have been going down in all of those areas where you have to pay out of your own pocket. LASIK surgery has been going down in cost and going up in quality. The same thing would happen if we unleashed the power of capitalism on every other part of the healthcare industry. Folks, we would live to be 100 years old, 200 years old. Life expectancy would skyrocket. We would heal this nation. We'd be the healthiest nation that ever existed in human history if we just had the guts to unleash the power of capitalism on healthcare.
Senator Walsh, your response?
You know, another area that we could save hundreds of millions of dollars in this country is if we had the ability to negotiate prescription drug prices. I visited a doctor's office in Missoula last week. He pulled out two vials like this. One of them, he says he pays about $2,200 for. Another one he pays $250 for. The $2,200 vial is the one that he has to use on Medicare patients. It's a requirement. If he had the option to use the same vial with the same medication in it to use on Medicare patients, he would save hundreds of thousands, if not millions of dollars right here in the state of Montana. If we allowed that across the country to negotiate prescription drug prices, we would save hundreds of millions of dollars right there.